This webinar will demonstrate how to set up for IUD insertions and removals. Intrauterine devices, or IUDs, are small, T-shaped devices that are inserted into the uterus to provide effective and long-lasting contraception. IUDs are more than 99% effective at preventing pregnancy. There are two types of IUD. Non-hormonal copper IUDs, such as Paragard, provide at least 10 years of pregnancy protection. Hormonal IUDs include Mirena and Skyla. Mirena provides at least 5 years of pregnancy protection, and Skyla provides at least 3 years. At the time of this recording, Unity is using the Paragard and Mirena IUDs. IUDs are effective contraceptive methods for almost all women. The following slides will demonstrate how to prepare for an IUD insertion. Prior to the procedure, a patient should have completed a urine pregnancy test. Check with the patient to make sure that a urine sample was collected. Pregnancy test results should be documented in ECW per Unity protocol. In addition, positive pregnancy test results should be brought to the attention of the provider, as the IUD procedure may need to be canceled. Provide the patient with 2 forms prior to IUD insertion. The first form is an informed consent form for procedures. You will fill in the patient's name, the procedure to be performed, the provider's name, and the patient's name and date of birth at the bottom of the page in compliance with Unity policy. Be sure to write Paragard IUD insertion or Mirena IUD insertion on the line labeled Name of Procedure. Once the patient signs the form, you will also sign the form on the line labeled Witness. The second form is a Unity 1-page IUD education sheet. The patient should review this education sheet and discuss any questions with the provider before signing the procedural consent. The forms you should provide look like this. These documents can be found in the Family Planning Resource Centers located at every Unity Community Health Center and on the Unity intranet. The exam table for an IUD insertion and an IUD removal should look the same. You should include a drape for the patient and a blue chucks pad for underneath the patient's buttocks. The materials for an IUD insertion will include non-sterile gloves, a light source for the speculum. It is important to check that the light is functional. If it is not, replace the light. A speculum. Check that all 3 sizes are available for the provider. Betadine, large cotton swabs, sterile gloves in the provider's chosen size, the IUD device itself. Either a Paragard Copper T or a Mirena levonorgestrel IUD should be included depending on the patient's request. Silver nitrate sticks, and a sanitary pad. Instruments for an IUD insertion will include single-tooth tenaculum forceps, a uterine sound. The provider may also want an os finder to be included on the tray, long scissors, and ring forceps. During procedure setup, you will leave these instruments in their sterile packaging. This will prevent contamination of the instruments. The remaining slides will demonstrate how to prepare for an IUD removal. Before the removal, you will also provide the patient with an informed consent form for procedures. You will fill in the patient's name, the procedure to be performed, the provider's name, and the patient's name and date of birth at the bottom of the page in compliance with Unity policy. Be sure to write IUD removal on the line labeled Name of Procedure. Once the patient signs the form, you will also sign the form on the line labeled Witness. This document can be found in the Family Planning Resource Centers located at every Unity Community Health Center and on the Unity intranet. The exam table for an IUD insertion and an IUD removal look the same. Again, you will include a drape for the patient and a blue chucks pad for underneath the patient's buttocks. Setup for an IUD removal should include non-sterile gloves, a light source for the speculum. Again, it is important to check that the light is functional. A speculum. Check that all 3 sizes are available for the provider. Ring forceps, and a sanitary pad for the patient. This picture shows the ring forceps removed from their sterile packaging. However, during the procedure setup, you will leave this instrument in its sterile packaging. This will prevent contamination of the instrument. This concludes the IUD Procedure Setup webinar.